I've never heard of any administration not looking for waste, fraud, and abuse, and I've never heard of anybody not finding it. But it's pennies on the dollar in terms of what you're spending. And what if they want real cuts? Because those numbers, you could cut everything there. You're still, nowhere in terms of the overall budget.
Chris, before I took this position, I thought what you thought. It's not right. We probably have $100 billion of fraud, waste, and abuse. And it's not just foreign elements, and there are out there trying to defraud us by stealing money for our most vulnerable. And I say that again. There are other countries that are actively involved in this process, or at least citizens of other countries involved in the process. But what I'm also realizing is that when you misalign what states want from what the national groups like CMS want, you end up with people gaming the system. They'll actually charge more for Medicaid patients than people who are on commercial insurance. These are massive numbers, Chris. When states can play games with their budget and then the federal government reimburses them for those games, you have inequality. Some states, California and New York, are really good at it. Other states aren't so good at it. So you've got taxpayers, for example, in Mississippi and Alabama and Texas paying for illegal immigrants getting Medicaid support in California. That's not fair. Most Americans watching this program right now are going to look up and say, what are you talking about? How's that possible? Well, if one state allows certain things to be under their Medicaid program, because Medicaid's run by states, and then passes a bill to the federal government, guess whose taxpayers are paying that bill? Every other state's.